Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I'm going to teach you vital signs. Vital signs, which is one of the procedures that nurses do carry out the first thing a patient comes to the world. Of course, it is a very important procedure that every nurse, every student nurse, every student midwife should have these skills at the tip of their fingers, so that whenever you have a patient or you want to teach your junior student, or and staff nurse teaching student nurse, she will not have any issues, right? So in this video, I'm going to use manual BP apparatus and stethoscope, and also digital BP apparatus, right? So sit back and watch this video till the end. Do not forget to like, share, and subscribe to my YouTube channel. Please, if there is any procedure you want me to carry out, please drop it at the comment section and I'll attend to it. Thank you for watching all my videos. Thank you. So before you carry out vital signs as a procedure, you must make your requirements ready. Do not forget also that it's a tray procedure. It's not a trolley procedure. So you have to set your requirements in a tray like this and bring it to the patient's side, either bedside, or if the patient is seated like this, you place it on the table, right? So now, first, you have to take permission from the patient and explain the procedure to the patient. Oh, good morning. My name is Nurse Clement, and I'll be your nurse for today. So I'm here to take your vital signs so that so that we continue with the process of taking care of you. So I'm going to tie the cuff of this BP apparatus on your arm. It's going to be a bit uncomfortable, and if it is too tight or it's paining you, please let me know. Can I go ahead?
Yes, ma'am.
So can you tell me your full name and your date of birth?
My name is Nana, and 12 of February 2000.
All right. So as I have identified the patient, now I know that this is the right patient I'm about to carry out this procedure on. Very important. Always identify your patients. Even in real world, please identify your patient to avoid carrying out procedures on the wrong patients, right? So the next thing is for me to take my patient's temperature, pulse, respiration, and BP. Sometimes you may have lots of patients, or you have a lot of work in the ward, right? You can use 1 minute to do 2 minutes to take pulse, respiration, and temperature. So how will you achieve that? First of all, you take the thermometer, clean it up, down, and remember, it's a spirited swab. Discard it in a receiver for used swab. If it is digital thermometer like this, you on it, right? Make sure that it's low this way. You on it. Make sure you on it properly, so that your patient, you can place it at the axilla of your patient. Remember, if the armpit or the axilla of the patient is wet, you can use dry swab to clean the excess sweat under the patient's axilla, right? For this patient, doesn't have much, the axilla is dry, so I can go ahead. Since I have set it, excuse me, I want to put thermometer under your armpit. So you ask the patient to close her arm, right, while the thermometer is reading. So after placing the thermometer under the patient's axilla, the next thing, as I told you earlier, you can use 2 minutes to take temperature, pulse, and respiration. Then you can use your left or right hand to take the pulse using to place your fingers here, right, and feel artery, isn't it? So you ask the patient to relax. You can ask the patient to place his or her hand on the table this way, and then they get the brachial artery. So I'm going to count her pulse for 1 minute, right? I'm going to count her pulse for 1 minute. So I assume that I have counted this pulse for 1 minute, and I will still leave my hand there so that the patient would to carry to take the respiration, so that the patient will not know that you are counting his or her respiration. Sometimes if patient notice that you are taking their respiration, they will try to alter it by either breathing fast or breathing low, right? Or trying to withhold the breathing, so that you get a wrong result. You never can know why the patient is in the hospital. The patient can be hysteric. So to avoid all this, you have to place your hand there, and while you are counting the respiration. So I'm going to count the respiration also for 1 minute. So now I'm done taking the counting the patient respiration, and already my thermometer is ready. So I've gotten the patient temperature. As you can see, I've gotten the patient temperature. So after, when I've removed the thermometer, I use swab again. I use spirited swab, of course, to disinfect it. Very important. Clean it up, down, and discard the swab, and off it. Since I'm using digital, off it. As you can see, now it's off, and replace it inside its container. So the next thing is for me now to take, since I am done taking respiration, pulse, and temperature. Remember, it is important that you always come with your blue and red pen. If the patient's vital signs is above normal, right, you record it with red pen. And if the patient vital signs is normal, you record it with blue pen, right? So now this my patient, her vital signs, her temperature is normal. So I record. After taking it, of course, you have to let the patient know what you've gotten. So the temperature of this patient is 36.2 degrees centigrade, while the pulse is 72 beats per minute, and the respiration is 20 cycle per minute. So these are the readings that I've gotten from this patient. So I've pen it down so that I will not forget. The next thing is for me to take the patient's BP. So I'm going to use this manual BP apparatus to do that. Always make sure that the mercury is on. Remember, when you are using this manual, there is a place that there is a button here that you can on and off. You can see indication of on and off. So now it's off. So remember to on it, right? Always on it before you start. Before you start, putting the cuff around the patient's arm. So I'm going to, can you help me pull the sleeve of your shirt up? Always ask your patient to pull the sleeve off before you place the cuff of the BP apparatus around the patient's arm. It is important to note that that you should always consider taking the BP using the left arm, but because of the position that I'm using now, I'm going to use the right arm to take the BP of my patient. So carefully tie it around the patient, round the patient's arm, right? Carefully tie it this way, and make sure that it's not too tight on the patient and it's not too loose. Then you start inflecting, right? You use this valve, right? Close the valve before you inflect. If you leave the valve open, you'll not be able to inflect the cuff of the BP apparatus. So always close it, right? When you close it, then you inflect. So, okay, I am, after tying the knot, I am inflecting. So for you to know that it's inflecting very well, you will see the mercury, of course, going up. The mercury is going up. So you can also use your fingers to feel the pulse. If you're not feeling the pulse of the patient, that means you have reached the where you can stop inflecting this cuff of the BP apparatus. Then as you close it, You keep it, then you pick your stethoscope. Make sure that it is working. How will you know that it's working? You place the earpiece inside your ears and touch the diaphragm whether it's working. If it's not working, you turn this. There is this button inside that when you turn it, you hear this cack sound to know that it's working. So now it's louder, it's on. So I place it at the diaphragm of the BPA of the stethoscope at the brachial artery this way, then gradually deflect and use your hand to gradually deflect the BP, the cuff. So the first loop that you will hear the sound from the patient arm, that is your systolic. And where the sound, the loop dip sound that you're hearing stops, that is your what? Diastolic, right? So that is how you get, for this patient, her BP is normal. I've gotten 110/60. So that's what I've gotten with this manual BP apparatus. So now that I am done, I have to deflect it completely, remove the sphic cuff, the cuff from the patient's hand carefully, and then place it back inside the sphic container, right? And also close it. Remember to also the mercury and place it back in the tray, right? With the stethoscope. So if need be, you can also take the patient's oxygen saturation. But since there is no need, I will not do that. But in case you want to take vital signs with this type of BP apparatus, of course, the digital, there is no need for you to take the pulse, because it will really show you the pulse. It will just take the pulse because it's digital BP apparatus you are taking, and it will show you that there is no need of you also using stethoscope to just get the systolic and the diastolic. You just read for you see it on the screen here, so there is no need. So I hope this video is helpful. I have come to the end of this procedure. Please do not forget to like, share and subscribe to my YouTube channel. Thank you for your support. Thank you for watching this video till the end. Bye bye.